There are two hormones involved in blood calcium regulation. One of the hormones, called PTH or parathyroid hormone, increases blood calcium levels. Its antagonistic hormone, called calcitonin, secreted by the thyroid gland, decreases blood calcium levels. Parathyroid hormone is secreted by the parathyroid gland. The parathyroid glands are a small glandular tissue located on the posterior aspect of the thyroid gland. These small parathyroid glandular tissue secretes parathyroid hormone. Parathyroid hormone has an effect on two organs, bones and kidneys. PTH causes bone to lose calcium, and that calcium will be deposited into the blood. PTH causes the kidneys into secreting higher levels of vitamin D. Vitamin D in turn is needed for the absorption of calcium from food. This calcium that is being absorbed from food will find its way into the blood, increasing blood calcium levels. PTH also affects the kidneys into increasing calcium reabsorption back into the blood. So the calcium that is being filtered out of the blood by the kidneys will be put back into the blood in the process called calcium reabsorption. All three effects will have an end result of increasing blood calcium levels. The antagonistic effect, the opposite effect, takes place by the hormone produced by the thyroid called calcitonin. Calcitonin affects bone by depositing more calcium into bone. Calcitonin is going to affect the kidneys by decreasing vitamin D production and by increasing calcium excretion, meaning the kidneys are now going to get rid of calcium, blood calcium, in the urine. These three combined effects will cause a decrease of blood calcium levels. The parathyroid gland is located in the posterior aspect of the thyroid and consists of glandular tissue, cells, mainly chief cells, which secrete parathyroid hormone. Hypocalcemia or low blood calcium levels triggers the parathyroid hormone into secreting PTH. PTH travels through the blood and has an effect on the osteoclast cells of the bone matrix. Osteoclasts are the cells that break down bone matrix. The broken down calcium is then released into the blood, increasing blood calcium levels. PTH also has an effect on the kidneys by triggering the kidneys into increasing the production of vitamin D. Vitamin D will be needed to increase absorption of calcium from food. Calcium is then secreted into or absorbed by the blood, and the overall effect will be again an increase in blood calcium levels. The third effect of PTH is again on the kidneys, where it increases what's called calcium reabsorption by the kidneys. Remember, the kidneys are filtering blood. In that filtrate, calcium will be filtered. The calcium could be peed out into the urine or put back into the blood. PTH stimulates the kidneys into putting the calcium back into the blood. The process is called calcium reabsorption, having the, again, effect of increasing blood calcium levels. The antagonistic hormone to PTH is a hormone called calcitonin. Calcitonin is secreted by the parafollicular cells of the thyroid gland. The overall effect of calcitonin will be opposite to that of PTH. Calcitonin will decrease blood calcium levels. Calcitonin secreted by the parafollicular cells of the thyroid will cause a decrease in blood calcium levels, and it will do so by affecting bone tissue. The effect of calcitonin on bone is to inhibit osteoclast activity. Therefore, osteoblast activity will override osteoclast activity and calcium will be put from blood into bone matrix, causing a decrease of blood calcium. Calcitonin also decreases blood calcium levels by having an effect on kidneys, causing an increase on calcium excretion. So the kidneys are going to lose calcium, blood calcium, in the urine, and it's going to cause a decrease in the production of vitamin D by the kidneys. The overall effect will again be a lowering of blood calcium levels. Regulation of secretion of PTH and calcitonin depends on levels of blood calcium. If blood calcium levels are high, the thyroid hormone will secrete calcitonin, which in turn will correct the high blood calcium levels, decreasing blood calcium back to normal levels. If blood calcium levels are abnormally low, the condition will trigger parathyroid gland into secreting parathyroid hormone. The final effect of PTH will be to increase blood calcium levels back to normal levels. So the effects of calcitonin and PTH is to return calcium levels back to homeostasis. Under abnormal conditions of blood calcium levels, high blood calcium levels, calcitonin is secreted, blood calcium is brought back down, back to normal homeostatic levels. Low blood calcium levels, PTH is secreted, bringing blood calcium levels back up to normal homeostatic levels.